When I was in Helsinki, Finland in 1991 to cover the Mr. Olympia contest for Joe Weider's Muscle and Fitness magazine, I remember going down to the dining room and running into Kevin Leverone's wife. Kevin Leverone was one of the top competitors that year. And I asked her where Kevin was, and she told me that this was a day before the Olympia. Kevin was in the sauna room. And that's something that when I noticed when I was in Finland, sauna rooms seem to be everywhere. It seems to be like a national pastime. And sure enough, it has. Saunas have been around for hundreds of years, and it's considered a relaxing and therapeutic practice. In fact, the Finnish people, they enjoy taking sauna baths weekly, or sometimes some of them take them every day. Now, besides being relaxing, does having regular sauna baths, does it do anything for your health and fitness? Well, it turns out there's a lot of research showing some remarkable effects of having sauna baths that can affect exercise recovery. In fact, a study just came out the other day that actually found that sauna produces effects in the human body that are comparable to moderate amounts of exercise. Even though with saunas you're usually just sitting there and not doing anything. I'll explain how that's possible later in this video. I should tell you, saunas come in three main varieties: dry saunas, steam saunas, and infrared. A dry sauna is based on the traditional Finnish sauna, and it has like low humidity and high temperature. The temperature ranges from anywhere from 176 to 212 degrees Fahrenheit. That's pretty damn hot, let me tell you. A steam sauna has higher humidity, and I guess a steam sauna is more or less like a steam room. It can't be. It's not as hot as a dry sauna. Steam saunas are more uncomfortable and stressful than dry saunas. Infrared saunas, like in the Japanese Wan therapy, they use infrared radiation lamps that emit both visible and infrared light. Infrared saunas emit longer wavelengths of infrared light that penetrate tissue to 0.1 millimeter deep. Near-infrared saunas emit shorter wavelengths that can penetrate the body up to 5 millimeters. Because of the deep tissue penetration, infrared saunas operate at cooler temperatures than dry saunas while still heating up the body. A lot of people who have saunas at home like to have the infrared because they're a little bit more convenient. Saunas are hot. They're very hot. In fact, the body's usual means of cooling down through sweating cannot compensate for the extreme heat that the body is exposed to in saunas. As a result, oral temperature rises 1 to 3 centigrades, or 1.8 to 5.4 degrees Fahrenheit, and rectal temperature increases up to 0.9 to 1.6 degrees 1.6 degree Fahrenheit. How they do the rectal temperature, I don't even want to think about, but that's another story. And this depends on humidity, temperature, and duration. The heart rate in a sauna, you can increase. Now, here's where it's similar to exercise. When you're in the sauna, your heart rate can go up to can increase by 130%. That's comparable to doing moderate aerobic exercise, even though you're just sitting here. And what causes that? It's caused by increased cardiac output. Your heart's working harder because it has to compensate. It has to increase the blood circulation to get rid of the heat that's being built up in the body from the exposure to the sauna. And also, the sauna reduces the blood pressure, which also causes the heart to increase its contractile ability or work. And that's why it's similar to exercise. Your hormonal system also responds to heat through the increase of several hormones. Among them is growth hormone. A lot of people don't know that. Yeah, you can get a growth hormone increase just by sitting in a sauna. But of course, growth hormone also increases after exercise, after deep sleep, and of course, fasting. Being in a sauna also increases beta endorphins, which are natural painkillers produced in the body and the brain. They're responsible for the pleasure and the pain-killing effects that are felt when you're in the sauna. That also increases. A catecholamine hormone called norepinephrine increases, and that's what causes the increased heart rate. Epinephrine is what causes your heart to speed faster when you work out. Norepinephrine also stimulates the release of fat from fat cells. Now, what are the health effects of saunas? Well, quite a bit. A single sauna session stimulates the immune system That means white blood cells, white blood cells such as lymphocytes, neutrophils, and basophil counts all increase. Your immune system it goes up really fast. And that means that translates into fewer illnesses. In a 6-month study, participants who engaged in regular sauna baths had significantly fewer colds than the control group of the same period. Again, this is because the sauna stimulates the immune response. So if you're exposed to let's say a rhinovirus, which causes colds, you'll have a much less ability to be infected by the cold because your immune system has been stimulated by the sauna. And by the way, a rhinovirus has nothing to do with rhinoceros. I know some of you probably will ask me that question. Nothing to do with rhinoceros. Saunas might also reduce oxidative stress, which is linked to oxidative stress involves the increased production of reactive oxygen species like free radicals and other byproducts of oxygen metabolism that are linked to cardiovascular disease, cancer, and degenerative disease, including aging. After a 30-minute aerobic workout, men who recovered in the sauna had significantly lower markers of oxidative stress than those who followed their workout in room temperature. So, in other words, exercise itself helps to decrease oxidative stress through the production of endogenous antioxidants such as superoxide dismutase, glutathione, and others. But when you go in a sauna, you actually add to that effect. So sauna is very compatible with exercise. What about cardiovascular health? Well, years ago, they used to tell people who had heart disease to keep away from saunas because of the effect on blood pressure, and they thought it was too much of a strain to the heart to be exposed to that kind of that level of heat. But more recent research has showed the opposite, that saunas can actually be safe and beneficial for people with cardiovascular disease. For example, a 2015 study followed 2,315 middle-aged Finnish men for 20 years. And by the way, most of the studies on saunas, as you might expect, come from Finland. Anyway, those who frequented saunas the most, let's say 4 to 7 days a week, they had a lower risk of sudden cardiac death, fatal coronary heart disease, and fatal cardiovascular disease compared to those who visited saunas 2 to 3 times or 1 time per week. Sauna use was also associated with lower all-cause mortality. In other words, undergoing regular sauna baths or exposure seemed to lower the risk of death from any cause. A large number of studies highlight many cardiovascular benefits of sauna use, especially the WAN infrared therapy. Some of the benefits, the specific benefits to the cardiovascular system elicited by sauna baths include increased left ventricular ejection fraction, which means it increases the pumping power of the heart. It improves exercise tolerance. It increases cardiac output. As far as blood pressure, going in a sauna, this might also surprise some of you. Going in a sauna actually raises nitric oxide, which of course is a vasodilator. And when nitric oxide goes up, blood pressure goes down. So exposure to a sauna will actually lower your blood pressure because of the increased nitric oxide. Now, what would happen if you took a nitric oxide supplement like arginine, pomegranate, or some of the others? Who knows? It might add to the effect. I don't think that's been studied, but you don't want your blood pressure to get too low or you wind up passing out. That's not good. You can hit your head on something. The sauna has been shown to lower blood pressure in studies. Frequenting the sauna twice weekly for 3 months to decrease blood pressure in men with high blood pressure from 166 over 101 to 143/92. That's similar to the same type of result you get from taking pharmaceutical blood pressure medications. Now, I want to quickly add, I'm not advocating anyone who's listening to this. If you're on blood pressure medication, don't have saunas and think you can get off your blood pressure medication. You'd have to check your blood pressure to see how you're responding to the saunas. I don't think saunas can be a substitute for blood pressure medication, but there's other better ways of getting off blood pressure medication. I'm going to talk about that in my Applied Metabolics newsletter, various nutraceuticals that can lower your blood pressure and keep it in a healthy range without any side effects whatsoever. And one of the main side effects of blood pressure medications is impotence. Men take note of that. Exercise is often involved for people with high blood pressure, but combining sauna use with exercise for 8 weeks lowered diastolic blood pressure 1.8 times greater and systolic blood pressure 3.3 times greater than just exercise alone. The patients who engage in both sauna and exercise also lost more weight and body fat than either one alone. Now, as far as your lipid profile, this refers to cholesterol, triglycerides, things that are measured in various lab tests. Regular sauna therapy can also improve lipid profiles. In healthy young men, total cholesterol and LDL, or low-density lipoprotein cholesterol, that's called the bad cholesterol because it's associated with the onset of atherosclerosis. It decreased after 3 weeks of sauna treatment, and blood plasma volume increased. In healthy young women, total cholesterol and LDL cholesterol decreased, while HDL cholesterol increased after 2 weeks of sauna therapy. Probably at least partially due to cardiovascular benefits, sauna use can improve athletic performance. In a crossover study, runners had better endurance and higher plasma red cell volume after regular sauna therapy. Cyclists also benefited from sauna therapy, as shown by increased plasma volume and better heart rate recovery after a cycling test. So sauna can actually provide ergogenic benefits to those who exercise. Sauna is also associated with so-called detoxification effects. I wrote an article about detoxification in my Applied Metabolics newsletter. Very extensive article. I suggest you read it if you really want to know the truth about detox. However, I will say most of the detox suggestion ideas are mostly BS, because your body has your liver, your kidneys are very, very well suited to detox most of the, let's say, the pollutants and garbage that enter your body. Most of the so-called detox techniques are just a bunch of crap to sell you various products that don't even work. However, in several small studies, detox therapies have involved incorporating sauna baths. For example, police officers were successfully treated for methamphetamine exposure using a combination of exercise, nutritional support, and sauna therapy. Women with occupational exposure to solvents improved after therapy that included sauna use. In a case report, a patient recovering from mercury poisoning also used sauna sweats to help recover while using chelation therapy. Chelation therapy involves providing chemicals which lock onto heavy metals like mercury and basically pull them out of your body, such as EDTA. Now, what about the additional benefits? There are even more benefits with sauna bathing. Some studies show that it reduces pain in patients with fibromyalgia. Fibromyalgia is diffuse muscle pain, as shown by various trigger points all over the body. It's very painful. It's more common in women. I wrote the first lay article on fibromyalgia in Muscle and Fitness, I think it was about 30 years ago. It's actually pretty widespread. Sauna bathing might help people with fibromyalgia. So women especially, if you have that, take note of that. Sauna bathing is also associated with reduced fatigue, anxiety, and depression in individuals with chronic fatigue syndrome. That was shown in a 2015 study in the Internal Medicine Journal. Some studies, at least 2 studies I know of, have shown a lower risk of Alzheimer's and dementia with increased sauna use. One study appeared in a 2017 issue in the journal Age and Aging. Sauna also, as I've noted, it improves relaxation and mental complaints in people who are depressed. An article in the 2009 issue of the Medical Hypotheses Journal showed that, or claimed that regular sauna bathing improves insulin sensitivity, which would help prevent the onset of type 2 diabetes. Going into a sauna regularly is very, very good for respiratory function, lung function. It improves respiratory symptoms, and it increases vital capacity, the ability to take in oxygen, minute ventilation or normal breathing, and forced expiratory volume of lungs, or the ability to exhale. In other words, sauna bathing, to make it long story short, increases lung function. A lot of what the body experiences in the sauna is similar to what happens during exercise. As I said, these effects include increased heart rate, increased nitric oxide, acute metabolic rate, and oxygen consumption. As I said, many of these benefits of sauna overlap with that of exercise. However, who should avoid sauna bathing or sauna exposure? I think it should be avoided by pregnant women, because exposure to heat, some studies have shown, can cause a fetus to be born with brain abnormalities, including neural tube defects and even, in some cases, brain tumors. So I think pregnant women should avoid saunas while they're pregnant, of course. Sauna also may temporarily affect male fertility. Some studies have shown that men who undergo saunas, they show decreases in sperm count, motility, or movement, and the average path velocity following a few weeks of regular sauna. But the truth is that if you're having problems with that, you might want to think about laying off the sauna if you're trying to produce a child. But most of the people that have undergone, such as the Finnish people, there's very little reporting of infertility in men who undergo regular sauna bathing. This is anecdotal, so it's a possibility. But again, if you're concerned about low sperm counts, it's probably a good idea to avoid sauna baths while you're trying to conceive. What about deaths? All right. The most of the problems with sauna baths have occurred when people kind of rub, maybe their skin touches these hot rocks or whatever's creating the heat. They can get skin burns and stuff like that. The few times that people have died in the sauna, it usually involves drinking. Somebody, let's say, drank too much beer or whatever. They went in the sauna, they might have passed out, and those people died. So you don't want to drink alcohol and go in the sauna. You also you don't want to exceed the recommended time in a sauna is 20 to 30 minutes. I would say don't exceed 30 minutes, even if you're not feeling uncomfortable. And this is I just want to read. There's one other thing to consider. This is from a review, an extensive review that was in the Mayo Clinic Proceedings called Cardiovascular and Other Health Benefits of Sauna Bathing, a review. And they talked about, I'm going to read it right from the journal here. It says something about, where is it? I'm talking about burns. Most of the burns were caused by accidental contact with hot stove and steam, with 40% occurring under the influence of alcohol. Short stays in the sauna room combined with rapid cooling off periods in cold water or shower are a common practice among sauna users. The health benefits and rationale for its use is not well known. However, it has been used in athletes who take a post-exercise plunge into an ice bath and is believed to enhance recovery and reduce muscle pain and soreness after the training sessions. By the way, I should add, recent studies that have looked at ice immersion after weight training have shown that it inhibits muscle protein synthesis. Not a good idea if you're trying to gain muscle mass. And a further reading from this study, the practice of short sauna baths interrupted with rapid cooling is generally safe for healthy persons, but this may be associated with adverse reactions such as ventricular and atrial arrhythmias. These are heart rhythm disturbances. It could be in patients with cardiovascular disease. In other words, if you have any kind of cardiovascular disease, going in a sauna, then exposing yourself to cold could set off a cardiac rhythm disturbance that can kill you. I mean, you don't want to do that. Cold receptors in the skin are stimulated with this type of activity, which increases production of catecholamines such as noradrenaline as a result of the stimulation of the sympathetic nervous system. There is subsequent vasoconstriction of skin vasculature and increased central blood volume, left ventricular end diastolic pressure and volume, and stroke volume, which increases the workload of the heart, making it hazardous for those with cardiovascular disease. Case fatalities have been recorded as a result of people diving headfirst into cold water right after a sauna bath because of the constriction of the coronary arteries that decreases coronary blood flow and oxygen delivery to the heart. There is a tendency towards enhanced corticotropin and cortisol secretion and sympathetic activity by increased catecholamine secretion, which suggests that ice-cold water immersion is a potentially harmful activity in those who are susceptible to hazardous cardiac arrhythmias and other cardiovascular disease symptoms. Simply put, if you have any kind of cardiovascular disease, never ever go into a sauna and jump into cold water, expose yourself to ice immersion or something like that. And as I said before, ice immersion or cold exposure after training was long considered a good recovery modality to help you recover from training. but the most recent studies that have examined specifically weight training have shown that when you expose yourself to cold or immerse yourself in ice or something like that after a workout, it actually blunts muscle protein synthesis, and it also that by doing so, it decreases muscle hypertrophy or muscle size gains and muscle strength gains, and also increases cortisol, which is a catabolic hormone. So I'm not a big fan of ice immersion after training. I think it's kind of an overplayed thing. I think it's just basically bullshit, to put it bluntly. Anyway, I'm at the 20-minute mark, and as I said, I try to keep the videos about 20 minutes. I hope that this video has educated you concerning the possible health benefits of sauna. I don't have exposure to a sauna myself, but if I did, I would use a sauna probably at least 3 times a week. I think it's really good for you, especially me because I have asthma. It probably helped my lungs. I got to tell you a quick story though. The original Gold's Gym had a sauna room, a dry sauna room upstairs in the men's dressing room, a little small dressing room, and nobody ever used it. But there was a famous guy who used to hang around Muscle Beach named Gypsy Boots. Gypsy Boots died a couple of years ago, but Gypsy Boots was one of the few people at the original Gold's Gym who used to use the sauna room upstairs, and he had a habit of urinating on the hot rocks in the sauna room, causing the whole men's dressing room to reek of a disgusting urine smell. And I remember being up there one day, and and Arnold came up to get ready to train, and he took one whiff. Gypsy Boots had just used the sauna room, and Arnold took a whiff, and he said, "What the hell is this?" And I told him, I said, "Arnold, I think Gypsy Boots urinated again in the sauna room." And Arnold said, I'll never forget his words, he says, "What a swine he is." I still remember that. Anyway, that's about it. And if you want to have the best information on nutrition, supplements, which ones work, which ones don't, exercise science, hormonal therapy, anti-aging research, fat loss techniques that really work, ergogenic aids, women's health and fitness, and much more, 40 to 50 pages every month, no ads, pure evidence-based research, including my own empirical experience of 58 years of training and study, all incorporated into my Applied Metabolics newsletter, www.appliedmetabolics.com. It's cheaper than buying a newspaper, cheaper than buying a latte at one of these Starbucks. You get amazing amount of information. Anyone who subscribes will confirm that. I put a lot of work into this. It's the best writing I've ever done in my 45 years of writing, over 9,500 articles. I know how to write in plain English. I will explain any technical term I use. You don't need more than a 6th grade education to fully understand my Applied Metabolics newsletter. Unlike other digital publications that are written in medical journal style, my Applied Metabolics newsletter is written in magazine style, since I was a magazine writer for, like I say, 40 years. So I know how to write for the public. So subscribe today, www.appliedmetabolics.com. Those who subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where every day I post new information on nutrition, exercise science, medicine, and general health. Really interesting stuff. That's only for subscribers. It's a private Facebook group. Also, I have an email portal on my Applied Metabolics website. Current subscribers only can send me short questions related to maybe perhaps something I wrote in Applied Metabolics, or if they want to ask me short questions about other topics, I'll be happy to answer that. Only for current subscribers. I don't accept unsolicited questions. You're welcome to leave comments under these videos, including suggestions for future videos. I can't guarantee that I'll answer every comment. It all depends on my time and mood, so anyway, that's about it. If you want to have the best, I'm going to always say it, if you want to have the best fun you'll ever have, go to your local shelter, adopt a dog, and please don't bring your dog into a sauna. Dogs have higher body temperature to begin with. I don't think saunas are very good for dogs, so don't even think about it. Anyway, you got to be pretty stupid to bring a dog in a sauna, really. I mean, then again, you have to be pretty stupid to urinate in a sauna too, but anyway, take care. Thanks for listening.